Hello and welcome. Today I have the honor to have the Ayurvedic doctor Mamatha here with me, and we will talk about Parkinson's and also I would say, untold wisdom about it.
Mhm.
Welcome, doctor. Do you still want to introduce yourself?
Yeah, I'm Dr. Mamatha. I've completed my bachelor's of Ayurveda medicine in India, and I'm staying in Berlin and working in the ASA experience. And yeah, and I thank you very much for giving me such an opportunity to speak about the Parkinsonism, and which is not figured out and not said properly, like what and all the causes and what will leads to that. So yeah, I am here to exchange my knowledge regarding those things. Yeah, thank you.
Thank you. Which brings me already to the first question because it's very specific topic and
Mhm.
you rarely hear people talk about it, especially in the Ayurvedic perspective or in that
Mhm.
approach. How do you think does Ayurveda offer a fundamentally different perspective for people living with Parkinson's?
Yeah, in Ayurveda, it is entirely different thing. Whereas in other medicine approach, they says it is due to the depletion of dopamine. So in Ayurveda, it is entirely different kind of thing. So that is when we figure out from the beginning. So how does the disease takes place in the body? So usually it is categorized into the stages and doshas and dhatus. These are all supportive element for the disease to begin. So when it comes to the age relation, so kapha people are in the beginning of the age, from since born till the adolescent, and the pitta people will come from the adolescent middle age till 45, 50, and vata peoples, they will be like after 50. So this Parkinsonism, it is mainly in the vata. So we consider that as a kampavata in Ayurveda. So it is like a kind of, it begins in at the third stage of our ages. So there we can say there will be some imbalance in the vata, or the strength or the weakness in the agni. So these are the depletion age. So whatever we feel so energetic, so young, so at the vata age it will be coming down. So at this time there will be people very much prone for the diseases. In that case, Parkinsonism is one of the kind. So whereas this cannot be explained, whereas it will come in this age, so people can fix it in mind. So I can begin my Parkinsonism in this age. So and another most thing is it might come from hereditary or kind of things, or if it doesn't come from hereditary, it is mainly due to the age relation problem. So it is mainly due to the vata imbalance in the body. So as we said, there are three bioenergies in the body: vata, pitta, and kapha. So if there is a vata imbalance, and then we have to look into the sthana, that is place where the vata dysfunction takes place, the mainly in the nervous system. So
Mhm.
if the vata imbalance in the nervous system takes place, or majja dhatu, what we say in Ayurveda, so there it begins with Parkinsonism. So
Mhm.
it is not mainly, yeah, it is of course due to the dopamine depletion, and also there are some other changes, that is tremors, pill rolling movement, like patient will be always doing like this kind of thing. So we can, by seeing only, we can get to know though this patient is going to face with Parkinsonism. So body coordination impairment and stiffness in the moment. Rather than this, the patient also feels there will be changes in physiological, emotional, and spiritual. So these three kind of things are not very much exposed. So the patient will be saying only the symptoms what they face, but there will be inner feelings. So there will be depression, there will be grief. So these all will take part and form a disease, that is Parkinsonism. So this is the Ayurveda approach. So how we can see. always the Ayurveda sees with the deep root causes. So where it is caused and how it is caused. It is not only due to the symptoms. There will be a cause which will show this is what the Parkinsonism is going to happen. Yeah.
Last Thank you for the deep explanation. Last time I was reading that people also talk about Parkinson in like it's a conversation with the body. Like, how
Yes.
does that resonate with you? Because that's how I experienced Ayurveda, and mostly people outside they have kind of the mindset, especially in Western medicine, they talk about it as a battle. Can you
Mhm.
explain what that means?
Yeah, of course. Uh, Parkinsonism, it is not only battling with the symptoms, and also it is battling with the emotional factors too. So if we give the hope for the patient, yeah, it will be like this. It can be managed like this. The patient himself will create a hope inside him. So that hope is like 50 to 60% of his treatment. So yeah, I can be better. I can do it myself better. Rather than treating the symptoms, so we have to give the spiritual hope for the patient. So this is what it happens. We are there with you, so we can cure it by this time, because it is a progressive neurological disorder. It can be only managed. So the management should be like in the prior most thing. So yeah, we are there. We can give the hope for the patient, emotionally talking to them. So emotionally, if the person is fit and fine, no matter what the battle is, he can fight. So this is what, rather by giving a symptomatic treatment, it is rather giving emotional kind of treatment makes the better.
That's what you just said. And
Mhm.
from what I heard and from what I experienced,
Yeah.
Ayurveda is not just like a journey where you basically say, oh, that's a system which fits to
Mhm.
all Parkinson patients, which is not. But to have said that, Ayurveda doesn't really offer that, as I said, one size fits to all. How
Mhm.
does your personalized consultation process help people to really, first of all, find their best healing path and also to basically start getting in touch with Ayurveda?
Yep. So, while treating the each and individual, Ayurveda treat them differently. It is not like symptomatic. For example, if you come with the pain, I can give you the pain medicines. But in Ayurveda, it doesn't work like that.
Mm,
Actually, each and individual is different. We
mm,
see their prakriti, we see their vikriti, and where the dosha is got imbalance and where the agni is got impairment. So this all factor will involve together. So by asking them how is the lifestyle, how is the emotional factor, by knowing all these things step by step, we can customize the treatment. Rather, we can't give directly treatment for the symptoms. So the patient comes with imbalance and stiffness in movement and tremors. Yeah, we can just say these are the symptoms of Parkinsonism, but I can't directly give the treatment for them. So for me, the main important thing is prakriti, vikruti, and their dosha imbalance and agni. By knowing all these supportive elements, I can customize the treatment for them. So this is how the Ayurveda works. It is not only me, where whoever the Ayurveda expertise, they all look into these factors. And the treatment always begins from increasing the agni, balancing the dosha, and rejuvenation. Rejuvenation is, it is very most important in Parkinsonism. That is strengthening their body, not to find the same symptoms again and again. So they have to strengthen their body and also their mind. This is how the Ayurveda protocol works.
You mentioned the emotional patterns
Yeah.
and how to shift them. Like, how can Ayurveda support that? Because I know, of course, you work with the natural based medicine, you work with the herbal oils. If we go into
Mhm.
massages, if you really go into the long treatments, but how can I support mentally, emotionally?
Yeah. first and foremost things, we have certain medicines which will herbs, I can say, which will helps in making their mind calm, like Ashwagandha, Shankhpushpi, Brahmi, Jatamamsi, and there are so many herbs are there which can help them to calm their mind. So, and the next step is like Panchakarma. So each and every Panchakarma will help in their management of Parkinsonism. For example, Abhyanga, if we take. So if there are certain oils which reduce the vata. As I said, Parkinsonism is mainly due to the vata imbalance. So there are certain oil which will balances the vata dosha. So by anyhow, just by giving an example, so if there is a friction, so there will be production of some heat or energy, I can say. So if we take the massage, if there is a friction in the body towards two objects or two ends, so there will be the generation of energy. So this energy will strengthens the nervous system of the patient. So this is how the Abhyanga works. So for that, along with the specific oil, which is very much wholesome for the Parkinsonism, this energy plus this herbal medicines will also get together and help them in their managing of the disease. Like if the patient is feeling tremors or any weakness in the nerves, it will strengthen the nerves. So this is how the Panchakarma works. And there are some other like Shirodhara, Shiropichu. So this will calms down the mind, as you said, for the emotional kind of thing. So Ashwagandha, Shankhpushpi, Brahmi. So this herbs which is mixed with certain oil and given Shirodhar or like Shiropichu or Shirobasti. So it will calms down the mind and relaxes. So if the mind calms down, there will be a very good amount of blood flow in the body. So if there is any block, it will remove, and then the patient might feel very much good in the physiological symptoms and emotional symptoms.
Sounds good.
Mhm.
When I'm at home and I basically say, yeah, I want to do something for myself. Let's say we start with a simple, I don't know, daily 3 minute self-massage or Abhyanga
Yeah.
to
Mhm.
calm the nerve system and the ease
Mhm.
system down. How would that look like? Like, does it already help if I just massage my hand or does it include the full body?
Yeah, that's a good question actually. It always includes whole body. So massage is like from head to toe.
Mhm.
If you're massage only for the hands or legs, you're just applying something to your hands and legs. It is not said to be a massage. So when it is got to done from head to toe in a proper manner with a proper friction and proper pressure, and then it is said to be a abhyanga. So this is very simple. The patient can apply the oil, and the best thing I can give the tip is like massage your body from upside down where the blood flow takes place. So if there is a blockage in the nervous system, so if you massage towards the blood flow, the blockage will be removed. And if it causes the stiffness or tremors or anything, it will strengthen the nerves. And yeah, it takes hardly 3 to 5 minutes of time. So that will help in a very good manner, I can say.
You mentioned ashwagandha, Brahmi, and
Mhm.
the other thing supporting the
Mhm.
neurological health. Is it something people could just take because they heard it, or is it, well, it's always useful to take consultation from the doctor and say,
Yes.
okay, this is my disbalance, this is how we can adjust. But
Mhm.
what is your opinion on that?
Yeah, actually, as I said, in Ayurveda, we see the patient in different manner,
Yeah.
and we have to check their prakriti, vikriti, and dosha imbalance, and agni also. Even on this four types of basis, it always the dosage and it should be given or not, or it can be easily digested by the patient or not. We have to check in that manner. So it totally depends on the expert only. So they can suggest you, "No, you can take this." Yeah, of course, by keeping the gross knowledge about the herbs and Ashwagandha, Brahmi, Shankhpushpi, these are all mind relaxing herbals.
Mm.
So you can see, you can just Google it and ask. Oh, it can give the some gist of the ideas, whatever the Ashwagandha does, Brahmi does, and the Shankhpushpi does. But it doesn't show like how dosage it should be given, at what time it should be given, with what, like Anupana we say. So along with ghee or honey or water, it doesn't show anything. It is better if you consult a doctor, like Asha experience provide wide range of expertise, so they can help in this kind of thing. So by saying only the just Ashwagandha, Brahmi, and Shankhpushpi, all three have predominant gunas, which calms down the mind and helps in relaxation.
We also talked about the digestion, the
Mhm.
Agni, basically the digestive fire activation.
Mhm.
Why is it so crucial for the brain health in relation with Parkinson's?
Yeah, Agni not only plays a main role in Parkinsonism, entire disease system. So whatever the wherever we says, like whatever the disease that born or that takes place from the abdomen itself. So if you eat something that should give you some energy, so if the Agni doesn't digest it properly, so it doesn't give you the energy. It doesn't metabolize or give you the energy. Or rather, it goes to the toxins and settle down as ama. Ama means like it is a toxin
Mm.
and which is undigested part in the abdomen. That will run through the strotus. Strotus means channels. So that channels will be blocked with ama, and there will be the amper in blood flow. So if the channels is not very much operative or functional good, that will be mainly due to the ama. So if the agni is treated well, if the agni is made in a proper balance kind of thing, we have four kind of agni, that is vishamagni, tikshna mandagni, and samagni. Vishamagni is irregular, tikshna is very much strong, and mandagni is like kapha, very much low. Samagni is all all set in one plane. So we have to maintain the sama agni, so there will be a very good digestion. So if there is a digestion, very well digestion, so there will be no concept of ama in the abdomen, and that will not block the strotus. And if there is no blockage, so the nervous system will pretty work pretty well. So this is the concept what we have. Even in Parkinsonism, if the nervous system is blocked, so there will be some symptoms comes from that. That is tremors, stiffness, or irregular impairment of movements. So these are the kind of things. So whatsoever, the Agni is very much important in all the kind of things.
Not just out of that, they say that it is the second brain in the body, like it's
Yes.
in your stomach, in your digestion. And having said that, the combination of food,
Mm-hmm.
of nutrition, of massage, and of the oil and herbs, how do you feel about sound therapy or like chanting or meditating for the nervous system? Because I've read so many studies,
Yes. Yes.
especially about that. Like, what is your opinion in that?
Yeah, even I heard so many of sound therapists, like and I've seen the patient is cured with the sound therapy, and I was just thinking maybe it is a temporary kind of treatment. No, actually it is a permanent, as I experienced myself.
Yes.
And the sound therapy is like, it is a kind of sound is like a kind of vibration. So that vibration will stimulates our vagus nerve in the body,
Mm.
so that will calms down. And if there is any grief or anger or any depression, by this different types of sound, it will calms down and gives the strength to the body and thoughts. So whatever we think, it will give the positive energy, I can say. So this positive energy will face the person into the positive hope. As I said, emotional factor also includes. So this positive hope will also plays a role in curing the Parkinsonism.
Very interesting. I have another question because yoga is always so profound that people only with like you have to make such strange movements that people are
Mm,
kind of afraid doing yoga. I was the same because I cannot do that. I don't like what if I do something wrong? Like
mm,
an easy approach to moving. And of course,
mm.
yoga is part of Ayurveda. What would you suggest, or what is your opinion?
Even yoga doesn't say that you have to move like this, move like that. Yoga definition itself, stiram sukham asanam.
Means?
The way you sit, the way you stand, the way you run, the way you move your body,
So the
it is always a
consciousness
yoga.
about moving.
Yeah, it's always a yoga. So if
Mhm.
you're sitting like that, it is also one yoga posture.
Mhm.
So yeah, of course, there are some certain posture which will relax that muscles particularly.
Okay.
So in
So
this
it's
case
more like the
also.
combination of the
Mm,
consciousness. Okay, this is how I feel when I have stiffness, because
mhm,
I can imagine if you're so in that daily routine with Parkinson, you don't, or you basically, your brain forgets what is a relaxed state.
mm,
So
yes,
basically, to tell the body again, oh, this is when I'm stiff and this is when I'm relaxed.
relaxed,
Basically,
yes.
train the body, different postures, as you said. And interesting.
Mhm. Yeah, that is what, like, the brain forget to be on moment at that time, because the person will be facing tremors and irregular movement. Even the person cannot hold the pen and write it or sign it.
Yes.
So these are the condition. At that time we have to give the emotional or spiritual support. Yeah, you can do it. Then the person will feel positive and say, yeah, I can do it, and then he can move the posture or do, if I do like this, if I do like that, so that will change himself. It will make me better. And
Mm.
even every yoga posture and whatever the yoga posture he does, that will help him.
I have another question because
Mhm,
having said that from you, like people cannot hold the pen
mhm,
anymore, and it can be a very difficult state also for loved ones, closed ones,
mhm,
family. Like, do you have a tip there how they can get help or to not? Because it can also cause an effect, even if I'm not dealing with Parkinson, like we have a case in the family, but it can
mhm.
affect the whole family.
Yes, of course. If one person is sad in the family, so they are family. It is prone to be like that. So we have to give them mental and emotional support to them.
Yes.
uh, they have to support them in each and every step. So even by walking or talking to them, or whatever they talk to them, it should be in a positive way. They should not say, yeah, you can do it, you can't do it, you are Parkinson. No, that is not a way. So the person who stays with them, they can be like very helpful for them, like a soulmate or kind of thing. So whatever they do, they will help and give the positive hope to them. And even while walking or sitting or thinking, some taking decision, so they can involve together and make a better moment along with them. That will surely help with them. So this is also a kind of treatment
Would
what
you
we
say
can
that
give.
it is helpful? Of course, you start the
Mhm,
the process with consultation and try to do what is
mhm,
possible for you. But on a long term, how is it the best that, of course, the person with Parkinson is doing a full panchakarma cycle, and also the
mhm,
person going with them to actually see and help to cure, because that can cure themselves as well, to be even
mhm.
stronger for that person. Like,
Yes.
what is your personal opinion or experience?
Yeah, I have seen two patients so far in my consultation. So I have given the Panchakarma treatment for them. So they got very much pretty well. So it can be only maintained kind of thing. So the patient was not even able to take his pen. After giving a certain massage or Abhyanga and Shirodhar, so Nasya also plays a very much role that will connect the brain and body coordination.
Mm.
So this is also a very important panchakarma, nasya karma, what we say. So that is a treatment for nasal. We put some drops to the nasal canal. So this also plays a very much important role. Yeah, each and every panchakarma, what we say, like Abhyanga, Shirodhar, nasya karma, pasti, and food therapy or spiritual therapy, emotional therapy. These are all plays a very much good role in curing the Parkinsonism. And we have found about like a survey says 80% of the people, they are very much pretty better with the Panchakarma core. So taking in a mind that Panchakarma might help them, because in Panchakarma it will remove the ama, it will stable the Vata, Pitta, Kapha, Dosha, it will balance us, and it will relax the muscle and gives the emotional strength. And this is a package of all the combination what you can see in Panchakarma,
Holistic.
since from the root to get a fruit. So
Hmm.
you can see the Panchakarma will help them the most.
Thank you so much, Dr.
Mhm.
Mamatha, for having you. And for everyone who listened and
Mhm.
has still questions, feel free to reach out to us for consultation or even deeper information.
Mhm.
And it has been a pleasure. Thank you
Yeah,
so
thank
much.
you. And even I thank you so much for giving the opportunity to speak about what I know regarding the Parkinsonism and how the people face their difficulties in managing those things. So it is just simple thing, and it can be managed by keeping in mind all the symptomatic, and most important thing is emotional and spiritual kind of thing in the mind. Yeah.
Thank you.